The skeletal system includes all the bones of the body, plus the joints where they attach to each other. Our skeleton protects our internal organs, provides a framework or scaffolding that allows us to stand upright and move, stores minerals that our body needs to function properly, and produces blood cells. Our muscles, pulling this way or that way on our bones, produce movement. And without the protection of our skeleton, even a simple bump on the head or chest could injure vital internal organs. Pound for pound, the bones of the skeletal system are stronger than steel. The skeletal system is made up of 206 different bones, which come in 4 basic shapes. Long bones, such as the femur. Short bones, like the wrist and ankle bones. Flat bones, such as those in the skull or scapula. And irregular bones, like the vertebrae. There are 2 types of bone tissue. Compact bone, which is dense, smooth, and very strong, and cancellous bone, which is spongy and lightweight. Both types of bone tissue contain living cells, which help make repairs if a bone is injured or broken. A typical long bone has a main shaft called the diaphysis, composed of compact bone, and 2 ends called epiphysis, composed of cancellous bones. The main shaft is covered with a membrane of living cells called periosteum, to which muscles and tendons attach themselves. Inside the main shaft is a cavity called the medullary cavity, which contains bone marrow. Bone marrow stores fat, produces blood cells, and plays an important part in the body's immune system. Without our bone's ability to grow larger or repair itself, our body would remain the same size from the time we were infants, and every broken bone would remain a permanent injury. From birth to the time we're around 18 to 25 years old, our bones go through a process called ossification. This involves cartilage or connective tissues in the bone being replaced with bone tissue so that the bone increases in size and strength. In adults, bone formation is usually limited to repair and replacement. Approximately 10% of all adult bone tissue in our body is replaced every year. Every stress that is put on a bone has an effect, and the bone reflects those stresses. For example, a person who constantly hunches over has bones that will gradually become curved as they are remodeled by the stress. After about age 50, skeletal bone is subject to a gradual weakening and decrease of density. Women after menopause and men over the age of 50 are at risk of developing a condition called osteoporosis. This is a disease that results in dramatic weakening and decrease of bone mass. Bones become so weak and brittle that they are susceptible to fractures, especially the hip, spine, and wrist. The skeletal system is divided into 2 divisions. The axial skeleton, which consists of bones that form the longitudinal axis of the body, and the appendicular skeleton, which consists of bones that are appended to the axial skeleton. The axial skeleton includes 80 bones comprising the skull, vertebral column, and thorax. The upper part of the skull, called the cranium, is the main source of protection for the brain and consists of 8 bones called the cranial bones. The face is formed by 14 bones called the facial bones and includes the mandible, whose movement allows for eating and speech. 6 small bones reside in the inner ears, 3 in each one, and aid in the transmission of sound. At birth, the bones of an infant's skull have yet to fuse together, and most babies have gaps between these bones, known as fontanels or soft spots. These provide flexibility and allow the skull to shift its shape a little during birth. They also make room for brain growth as the infant's brain develops rapidly. By the age of 2, these gaps close and the bones fuse together. An average human skull weighs about 1 kilogram. In comparison, a dinosaur skull of roughly the same size weighs over 300 kilograms. This is more than the total body weight of 3 big men. Dinosaurs possessed thick, strong skulls and small brains, while we possess relatively large brains, but correspondingly lighter and weaker skulls. You'll have to use your head to figure out which trade-off is more beneficial. The vertebral column supports the head and encloses and protects the spinal cord and nerve roots. In adults, it consists of 26 bones stacked one on top of the other, called vertebrae. It is divided into 5 sections: cervical, thoracic, lumbar, sacral, and coccygeal. Children possess 33 vertebrae. As their bodies mature, the sacral and coccygeal vertebrae fuse. Seen from the side, the spine is not a straight vertical line, but rather has 4 distinct curves. These curves increase the carrying strength of the vertebral column and make balance possible when standing in an upright position. The joints between the vertebrae are cushioned by discs of cartilage, allowing for a great deal of bending and twisting. Because of the downward pressure exerted on the vertebrae by gravity, we go to bed every night a few millimeters shorter than when we woke up in the morning. The discs recover as we sleep, but as we get older, they lose some of their elasticity. As a result, an 80-year-old man is often several centimeters shorter than he was as a young adult. The thorax, or rib cage, surrounds and protects the heart, lungs, and thoracic blood vessels. It consists of the sternum and 12 pairs of ribs. The first 7 pairs of ribs are called true ribs because they are connected to the sternum by costal cartilage. The next 3 pairs are called false ribs because they connect only indirectly to the sternum by cartilage extensions. The last 2 pairs are called floating ribs because they have no connection with the sternum at all. When we are born, our sternum is in 3 parts and is the last bone in our body to fuse together, usually after the age of 30. A single bone in our throat, called the hyoid bone, is unique. All the other bones in our body are articulated, that is, they connect to other bones. The hyoid bone, though, is our body's only unarticulated bone. Muscles in the throat attach to it in order to manipulate the tongue and aid in speaking and swallowing. The appendicular skeleton consists of the bones of the shoulders, upper extremities, hips, and lower extremities. The bones of the upper extremities, or arms, are connected to the axial skeleton via the shoulder girdle. This consists of the scapula, or shoulder blade, and the clavicle, or collarbone. The arm itself is composed of the humerus, or upper arm, and the radius and ulna of the forearm, plus the wrist and hand, which consist of 27 separate bones. Because of this large number of small bones, our hands are capable of more movement than any other part of our body. The bones of the lower extremities, or legs, are connected to the axial skeleton via the pelvic girdle, which is formed by the 2 hip bones. It protects the bladder, reproductive organs, lower colon, and rectum. In the male, the pubic arch of the pelvis is less than 90 degrees wide, in the female, greater than 90 degrees. This difference in width is necessary for the female pelvis to accommodate childbirth. The longest, heaviest, and strongest bone in the body is the femur, commonly called the thigh bone. At one end, it is connected to the pelvis, and at the other end, to the lower leg, which is made up of the tibia, or shin bone, and fibula. The tibia bears all of our body's weight. The fibula bears no weight at all. The patella, or kneecap, is a large bone between the femur and fibula. It protects the knee joint and tendons that form the knee. The bones of the ankle and foot must carry all of our body weight as we stand, walk, or run. And the 26 bones and 33 joints that make up our ankle and foot enable it to do just that. In fact, mere running can subject the ankles and feet to forces equal to 5 or more times your body weight. That's like carrying a full-size motorcycle on your shoulders. The point where two bones meet is called an articulation or joint. Joints are usually constructed of cartilage and fibrous connective tissue and are classified according to the amount of movement they allow. Immovable, or synarthrosis joints, include the sutures that connect different parts of the cranium. Partially movable, or amphiarthrosis joints, include the symphysis, which connects together the bones of the pelvis. The most common joint is the freely movable or diarthrosis joint. There are 6 types of diarthrosis joints. A gliding joint has 2 relatively flat surfaces that slide across each other, such as the carpals in the hand. A hinge joint moves like a door as found in the elbow. A pivot joint at the top of the vertebral column allows for rotating the head back and forth. An ellipsoidal joint allows movement along or across 2 planes, like fingers that can move up and down and sideways. A saddle joint at the base of the thumb allows very precise angular motions. Ball and socket joints are the freest of all. They allow nearly full rotation as found in the hip and shoulder sockets. From bone cells that are too small to see, all the way up to the large femur in our leg, our bones give us support and protection and help us move. Bones even give us blood cells to transport oxygen throughout our body and fight diseases. The entire skeletal system of an average adult weighs less than 10 kilograms. If you attempted to replace this with a steel skeleton that was just as strong, it would weigh 400 kilograms and still would not have the resilience of bone or the ability to repair itself. Harder than reinforced concrete, lighter than stainless steel, able to repair itself, bone is the near perfect material to provide the framework for the human body.